The Women, Infants, and Children program, also known as WIC, was initially introduced as a temporary 2-year program in 1972. In 1975, WIC became a permanent federal program and is administered through the Food and Nutrition Service through the United States Department of Agriculture. The WIC program provides benefits such as supplemental nutritious foods, nutrition education and counseling at all WIC clinics, screenings and referrals to other welfare, social service, or health agencies to those who are low income and more at risk nutritionally. This would include pregnant women, women who are breastfeeding, non-breastfeeding postpartum women, infants, and children up to their 5th birthday. The WIC program was created as a response to the recognition that both poverty and hunger were becoming widespread throughout the United States, and that not having proper nutrition could be rather dangerous for pregnant women, new mothers, and their infants and children. In 2011, WIC benefited almost 9 million women, infants, and children each month. Some of the administrative-based issues with WIC include federal funding and state incentives, funding for NSA, expanding enrollment in the WIC program, possible effects of making changes to WIC food packages, infant formula costs, and food prices. WIC is a federal grant program for which Congress approves a particular amount of funding every year in order for the program to operate. The Food and Nutrition Service is in charge of administrating the program and providing funds to WIC state agencies, primarily state health departments, in order to pay for WIC foods, breastfeeding preferment and support, education about nutrition, and administrative costs. The WIC program is available in all 50 states. There are 90 total state agencies. These agencies administer the program through 1,836 local agencies and 9,000 clinic sites. As mentioned earlier, the objective of the WIC program is to provide supplemental nutritious foods into the diet of low-income pregnant women, breastfeeding women up to 1 year postpartum, non-breastfeeding women up to 6 months postpartum, infants and children under the age of 5 who have been determined to be at nutritional risk. Applicants are screened, and nutritional risk is considered to be persons who are underweight, have anemia, smokers of maternal age, and have had history of poor pregnancy outcomes and or a history of pregnancy complications. If a person is not consuming the U.S. Dietary Guidelines recommended amounts of protein or iron in their daily diet, they are also considered as a nutritional risk. It is believed that intervention during the prenatal period helps to improve development of the fetus and reduces the risk of having a child born with a low birth rate, anemia, or having a short gestation period. The WIC program also strives to educate women about nutrition and offer referrals to healthcare for low-income families during their critical periods of development. In 1972, there was a growing concern over malnutrition among poverty-stricken mothers and their young children, so WIC was created and piloted as a supplemental food program that was aimed at improving the health of those pregnant mothers and their children. Two years later, in January of 1974, the very first WIC site opened its doors in Pineville, Kentucky, offering 2 nutrition services, one for breastfeeding women and their children, and one for infants. Persons who were eligible received foods that were rich in calcium, protein, iron, and vitamins A and C. WIC programs quickly spread to 45 other states throughout the same year. The WIC program became a permanent government program by legislation in 1975, and the eligibility was changed in order to include non-breastfeeding women and children up to age 5. The program initially launched providing supplemental foods only to breastfeeding postpartum mothers and children up to the age of 4. In 1978, legislation introduced new essentials into the WIC program, such as nutritional education must now be provided, that the food supplemented should contain nutrients that are lacking in the low-income target families, and that foods should have lower levels of sugar, salt, and fat. It was also determined that each state needed to direct referrals to outside health and social service agencies for services such as immunizations, family planning, drug and alcohol abuse prevention, and child abuse counseling. The WIC program remained unchanged until 1992, when WIC came out with an enhanced food package that was just for breastfeeding mothers in order to further promote breastfeeding. Then, in 1997, the USDA came out with the campaign Loving Support Makes Breastfeeding Work in hopes to increase breastfeeding rates amongst WIC mothers and in hopes to improve public support of breastfeeding. In 2004, women with breastfeeding experience and training became counselors through WIC to help support other mothers learning to breastfeed. This program was dubbed the Breastfeeding Peer Counsel Initiative, and many of the counselors were often past WIC participants. In 2009, the USDA introduced a new food package that was consistent with the dietary guidelines for Americans and established recommendations for infants and children over the age of 2. Fruits, vegetables, and the ability to substitute for culturally sensitive WIC foods are now part of the WIC program. Women who exclusively breastfeed are now able to receive more of the healthy food items with the food package established exclusively for breastfeeding mothers. WIC was built on the premises that early intervention of healthy eating habits will decrease the number of health and medical-related issues for women and children. In the 1960s, the idea of Americans being malnourished came to light. Various studies were done and documentaries publicized the issue. At a White House conference on food in 1969, a recommendation was made that more attention needed to be paid to women and preschool children. Due to growing concern about malnutrition, the USDA established the Commodity Supplemental Food Program in 1969. However, this program failed to meet the needs of pregnant women and infants. In 1968, a group of physicians met with officials from the Department of Health, Education, and Welfare and the USDA. The topic they discussed was pregnant young women and the various conditions that were caused by the lack of food. This meeting was the building blocks to make neighborhood food commissaries or neighborhood clinics that would be stocked with food to supplement the nutritional needs of these women. There would also be doctors at the clinics that would prescribe the needed foods using a prescription voucher the women would take to the commissary in order to pick up their food package. WIC was formally approved by a revision to the Child Nutrition Act of 1966 and used the previous voucher program as a model. The program began as a pilot program in hopes it would later become a permanent program. WIC state agencies are in charge of program operations within their local jurisdictions. They distribute funds to WIC sponsoring agencies and discuss rebate contracts with the different infant formula manufacturers. State agencies have quite a bit of leeway when it comes to the operations of their local programs. WIC state agencies decide which brands, forms, and package sizes to include in their list of WIC-approved foods. Services are provided directly to WIC participants through state or county health departments. Some states even have WIC programs in schools, community centers, hospitals, and migrant health centers. These local clinics determine eligibility for applicants, provide nutritional education, make referrals, and distribute food checks as necessary. These local sites are where most people connect with the WIC staff. WIC eligibility criteria is identical for all states throughout the program. Clients must meet the eligibility income guidelines and have medical or nutritional needs. The federal poverty guidelines are used, and to become income eligible, the household may earn up to and including 185% of federal guidelines. So, a family of 4 can be eligible for WIC services if their income is less than $43,568 annually or $3,631 monthly. If a family is eligible for other state benefit programs, then they automatically meet the WIC program's eligibility requirements. 1 in 4 women in the United States is enrolled in the WIC program. Because of the high threshold for income in the income guideline, many people are eligible for the WIC program but do not realize it. WIC is primarily implemented through local state agencies such as health departments. WIC staff also offer classes on many topics important to women and their children, such as meal planning, maintaining healthy weight, how to handle picky eaters, shopping on a budget, and how to care for a new baby. These classes are offered free of charge and often taught by trained staff members. Since there are still so many women and children that are not taking advantage of the WIC program, there needs to be more focus on making sure that those who need the WIC program the most are getting the information that they need to become enrolled. Other social service agencies should make sure that if someone meets criteria for WIC, that they are informed and given information on how to get enrolled. Eligibility guidelines should be made clearer for those in various social service agencies so there is no doubt whether or not someone would qualify for the program. For example, if a mother seeks assistance with food stamps, she should also be made aware that she is eligible to receive both food stamps and WIC. There is a common misconception that if you have food stamps, you cannot do WIC, but this is not the case. Since WIC is not a program that is supposed to completely cover food costs for a household, but be supplemental, there is no reason a family shouldn't apply for WIC. There is no doubt in my mind that the WIC program should continue. WIC is one of the most expansive government food programs behind food stamps. Research shows that the WIC program has helped out those women and children who need it the most. WIC has also helped with lowering the infant mortality rate and lowered the chances of those in poverty giving birth to children that are below normal birth rate. The overall mission of the WIC program is very beneficial to lower income mothers and their children.